All right, it is a couple minutes after 10, so we'll go ahead and get started this morning. Happy Friday, everyone. I hope this week was a little bit smoother than last week for everybody. I know we're all slowly adjusting to our new normal, so we appreciate everyone joining our call today. This is our second of at least 5 weekly calls for members, just to give updates about what we're hearing around the COVID pandemic, get your questions answered, provide an opportunity to resource share, and then also talk about if there are any advocacy opportunities coming up as it relates to things going on. So there'll be just a couple of kind of housekeeping things. Today, like I said, we just want to make sure that you all are as up to date in your practice as possible about all things that are ever changing in our current world, and then to provide some forum for discussion for you all. Today's meeting is a little bit different from last week's in that the second half, so our time allotted for our call is until 11 a.m. We may or may not use all of that time, but immediately following when we're finished with our official business for today, we're going to transition that into our private practice group and our aging and gerontology group. So for any folks who are in either of those areas of practice that would like to stick around for that call, please do so. Those groups meet every month, the first Friday of every month. The private practice group is normally at this time, but we thought that this meeting coincided a lot with folks who are in that area already. So that's going to be a good resource if you want to have additional questions specific to private practice that maybe aren't relevant to the bigger discussion. Please feel free to stick around for that call today. Some housekeeping. We will have lines muted for right now, just to make sure that there's not a lot of sound, background noise. Please feel free to type anything into the chat box if you have questions or resources that you want to share. The chat box is great because it also gives us a printed list that we can share with everybody afterward. And then we will make sure to get any questions answered throughout the webinar. We will also open up lines as necessary, especially at the end when there's kind of some open forum for that. Okay, if you'd like to have your camera on, I see some smiling faces. It's so nice to see some social workers out there. I see Judy all the way up in the UP. It's good to see you, Judy. I saw your snow tracks yesterday. It's a little bit warmer down here. We will record this webinar today. So if you didn't get a chance to watch last week, we'll talk a little bit for some of the stuff we talked about last week, but a lot of what we're going to talk today is going to be new information. So let's go ahead and get started. Our agenda for today is give some updates around telehealth and billing. We know that's still a lot of questions for folks. Some policy updates. Most of those are going to be just returning, not a whole lot of new stuff there. Talk about some of the new executive orders that impact us. Some other action that we're working on, including a mental health hotline, updates about continuing education, LARA, CSWE, ASWB, and some upcoming training and other resources. I will also do a quick demo once we get at the end of today's session with where you can find some of these specific resources, specifically with NASW. I know sometimes it's difficult to navigate both either the state or the national website, so I just want to do a quick demo with folks. All right, so first we're going to go ahead and get started and just give a quick telehealth and billing update. I'm going to go ahead, Algeria is on, and then our Executive Director, Maxine, is going to give some updates as well.
Hey everybody, so thank you for joining. We know that many of you have had questions around telehealth, and we have been trying our hardest to track them. Max just joined us. Hi Max, how are you?
I'm good.
Great. We were just about to give members just some updates around telehealth, and then I'll hand it over to you to talk a little bit about the reimbursement alignment from the Upper Peninsula Health Plan.
All right.
So many of you have asked about audio-only services. We know that our national office is still working to advocate for audio-only, especially as it relates to Medicare. We understand that for Medicaid-only clients, that video and audio is supposed to be accepted. And there are some plans that we have heard also are accepting audio, such as Blue Cross Blue Shield. And however, Blue Cross Network is not. However, we still have been hearing some feedback from members about that Blue Cross Blue Shield is only operating on a case-by-case situation for some clients. So we just continue to tell you and to tell your clients to check in with their insurance provider and continue to let us know if you have issues around various different health plans. I wanted to talk just a little bit about some of the Medicaid bulletins that came over recently.
Algeria, before you do that, can I add to the audio-only services?
Sure, go ahead.
I recently spoke with a biller, and she will be on in a couple of weeks, or next week or the week after. She's apprehensive to talk about phone services and audio-only services because what she said is it's changing day to day. And so one day she'll get a notification that that a certain insurance company, for instance, a Medicaid plan, will do audio. And then within a short period of time, they'll retract that and change it to something else. So what she's waiting for is for things to kind of smooth out, and then she'll give us the updates. In the meantime, she has agreed to send Dwayne for our website the updates as she receives them. Her concern is that she knows that some of her colleagues are posting the billing, for instance, that certain plans will do audio, and then after they post it, it's retracted. So, or they'll post that it's not audio, and then it will be. So for sake of confusion, she believes it'll be settled out within a week, and then she's more than willing to come on and talk to everyone about what's happening with billing.
Thanks, Max.
Okay.
And I'll go ahead and just let you talk a little bit more about the Upper Peninsula Health Plan and the challenges that people were having and the new update.
Okay.
Yeah.
So we received, as did Judy, hi Judy, an email from a member in the Upper Peninsula, and Judy Krause is our board representative from the Upper Peninsula, and she and I have spoken about this for quite some time. Not quite some time. We've spent a lot of time on the phone talking about this. And what happened was UPHP sent out something stating that providers will no longer be reimbursed by the Medicaid plan at the $77. And that was the physician rate, and they were going back to the $58 one rate for Medicaid provision of services. So we spent some time trying to figure this out. And I think many of you remember when the clawback period happened. Medicaid had aired from 2016 to 2019 and began paying social workers the physician rate of $77. And then a light bulb went on in 2019, and they realized that they had been doing that. So they started to contact providers and ask for that money back. So NASW went to bat, and we were able, with the help of legislators, to put a halt to the clawbacks. However, what that meant was not that they would continue at 77, but that they would revert back to the rate 3 years ago, which was $58. So many of us in the Lower Peninsula were aware of that. And then UPHP, because the health plans can operate somewhat independently, UPHP evidently has been reimbursing at the 77, and then suddenly sent out an update stating that they were going to be following the Medicaid guidance from the state and reverting back to the $58. Then yesterday, we received an update to that decision by UPHP. And in essence, what it said was starting April 1st, 2020, which was when they were going to revert back, but they made a decision that April 1st, 2020, they were not going to revert back to the $58, but continue on at the $77. And that would be until further notice. So we don't know what further notice is, but what we do hope to do is to take a look at how long it's been since social workers received a raise from, I use that term, well, I just use that term, for our Medicaid reimbursement. And my hunch is it's been a number of years. So our hope is to use the data that we're going to collect to push for an increase for social work rate of pay. Then today, while I was in the shower, it occurred to me, I'm not sure how many minutes the $77 is for physicians, and what that CPT code is in terms of minutes. And I think it would be useful for NASW to check that out, because if a physician is making 77 for 30 minutes and a social worker is spending 45 to 50 minutes with a client, then the 77 or something in that range would make sense. So to take a look at it in terms of time, I think is going to be another approach that we'll take. So did I cover it all, Algeria?
Yeah, you did. Thanks, Max. That was great.
Okay, the only other question that we have got at this point kind of around telehealth and billing is specifically for folks who have limited licenses or work with limited licensees and take insurances that don't allow them to bill directly and having to bill under a supervisor, usually an on-site supervisor. And what does that mean right now if there is no on-site? Can virtual supervision be approved for that sort of session? And we don't have a definitive answer yet, but Max, maybe correct me if I'm wrong, but at this point we are assuming that virtual supervision will count at this point as approved, as it was on site, as all of our practices are changing.
That's my hunch, because there are no other options, right? So they're in violation of the state order if someone meets with someone. So I think we have certainly good basis to justify virtual supervision.
And just make sure everything is documented as best as possible, if that's the case in your practice.
And I will say on our website, we have created the COVID-19 resources tab for clinicians and social workers. And so if you click on the COVID-19 resources and go down to telehealth resources, you'll have a little bit more information around some of the things we talked about today as well.
Yeah, and I'll do a demo of where to find that a little bit later. Any other updates around telling or bill health?
Nope, not for me.
Telehealth or billing? Bill of health. All right.
Just quickly, sorry, that's my dog in the background. Just be sure and use the 95 code when billing for virtual sessions.
Great.
You better mute me.
I will. All right, Algeria, these were carryover from last week around the Medicaid bulletin.
Yep. So these were just carryovers from the Medicaid bulletins from last week that expanded the ability for Medicaid to do visual and audio telehealth, as well as relaxing the face-to-face requirements. And Dwayne will do a demo here shortly, but again, on our COVID-19 resources tab, if you click under the Michigan COVID-19 resources, we have a link that says, click here to review MDHHS proposed Medicaid changes. And that'll take you directly to the MDHHS proposed Medicaid changes website. And that way you can review all of the proposed policies that have come out as of recently. And it's a really important website, especially for clinicians. So please take a look at that if you haven't already. Yeah, so moving on to our national action alerts, we put out 2 action alerts. We talked about this on our last call as well. To members to advocate for personal protective equipment for social workers, as well as audio-only telehealth services for Medicaid into the current stimulus package. We have a call actually later today to get an update about where some things are with some of those action alerts, and especially the CARES Act that came out recently. I believe audio telehealth was supposed to go into that plan, and we're just going to get an update today to see where it is along the status. So we may have more information for you on that on our next call. Okay, moving on to some of the executive orders. I just wanted to talk about one that just happened yesterday, and I know it's troubling for many folks, and that's the closure of the K-12 schools for the rest of the year. Governor Whitmer had her press release yesterday stating that the schools in Michigan will be closed. However, instruction is still set to go on, and food distribution is still set to happen. From my understanding, employees, teachers, and things of that sort are still supposed to be paid. But it does pose worry for many social workers as it relates to children who may find themselves in abuse and neglect situations. So we will be staying on top of that and making sure that our children are still safe. But I wanted to just make sure that everyone was aware of that executive order. And currently, she is proposing, it has not gone through yet, but a potential extension of the stay-at-home order. So that's the most recent executive orders updates. And again, we have that on our website. That'll link you to all of the executive orders and directives.
Great. And yeah, so most of you probably heard that the governor is proposing a 70-day extension for the stay-at-home order. And we know that social workers are in a mixed settings in terms of where we work. Many folks work at home or already do private practice work. And we just want to reinforce that we really want folks to be following the governor's guidelines as best as possible, and to, if at all possible, not be having in-person clinical sessions unless that is necessary for the client. We know it's tricky for some people, and some people it's absolutely not going to work. And so we know with continuation of care that there may be some clients that you still need to see face-to-face in extreme circumstances, but we are pressing everyone to follow the governor's guidelines as best as possible and to work remotely if at all possible. Okay, so the other executive orders that we did talk about a little bit last week that I did want to just reinforce for everybody, because there are a couple that relate to continuing education and limited license folks. So Executive Order 2020-13 allows LARA to renew licenses even if continuing education has not been reached. So we know there's been a lot of questions around, if I don't have all of my physical CEs complete by my April 30th deadline, what do I do? Most of the classes, almost all of the classes, or if not all of the classes that I had scheduled to are canceled. This does allow LARA to still renew your application without full CE completion. However, we haven't gotten full clarification from LARA about what that's going to mean or how they're going to track that, but we're recommending for folks, obviously, if you can still get your CEs, you should, and have documentation of all of that. But if you do renew your your license and you are missing a few, and then if you get audited, there likely you'll have to submit some sort of record or written statement saying why you didn't have the rest. And if you have some sort of documentation, say I had scheduled or registered for these particular courses, they were canceled because of the COVID virus, that should suffice at this point. We're seeking some clarification on this right now, but we haven't heard back. The state's dealing with a lot of executive orders, so we hopefully, maybe by next Friday's call, we'll have some clarification on that. And then the second piece as it relates to continuing education is LARA may recognize hours worked with responding to COVID-19 as hours towards continuing ed. So this is something that we've also asked for clarification on about how do you record that or track that, or what counts as responding. Can it be research? Can it be, is it folks who are working in a hospital setting? What does that actually look like? But our best assumption at this point is it will be some sort of self-certification. If you get audited, you can say, you know, you work for 40 hours or whatever doing COVID response work. Executive orders, I think we're all assuming it's just going to be for folks renewing this particular April. If this goes on much longer, it may expand to folks who are in the next year's cycle. But many of the organizations offering continuing education are making their programs virtual at this point. So as it relates to continuing education, just a reminder, so if a program is online, but the presenter is talking live, it does count as an in-person credit. So all of our monthly lunch and learns, many of the continuing ed programs across the state, that's what they're doing for programs that may have been scheduled to be in person. Even I know conferences are moving online if at all possible. And of your 45 hours, half can be alternative learning, so not live. That would include a pre-recorded webinar, journals, like our virtual book club, things like that. The Continuing Ed Collaborative at the state level has a really easy way to find alternative learning courses if you just need a few more to get your license up to renewal. So that's a good resource at socialworkcec.com. The other thing as it relates to executive orders that I did not put on here relates to fingerprinting. So one of the executive orders came out this week that allows the state to process licenses without fingerprinting being complete, because most, if not all, of those organizations are closed right now. We are seeking clarification about specifically how somebody graduating would be able to get their limited license without that piece being complete. We have not heard back about what that looks like, and I'm sure LARA is trying to wrestle with that right now as well, because we know that there are folks graduating pretty much in like a few weeks from now that are thinking about this pretty substantially. So again, we're really hopeful by next Friday that we'll have some clarification about what COVID response means in terms of continuing education, and what that not needing fingerprinting actually is going to look like in practice. So those are just a couple of updates around continuing education. As it also relates to LARA, so the physical LARA offices, the licensing and regulatory affairs offices, are closed right now. They are asking folks if you have any documents that need to be attached to your license, that those be emailed to LARA. It's at bpldata@michigan.gov. The only thing that does not include is limited license first-time applicants. So if you are a graduate or a social worker that's been out there that has been waiting to get your limited license, you still need to physically mail in the application for your limited license and your payment. This is different from what they originally had said. So we had put out a notice and then had to retract it the next day because they changed what they had put out. So know that if you are a student graduating, your initial limited license paperwork needs to be physically mailed still with your payment. They don't anticipate at this point that there should be much of a delay in getting anything processed. Hopefully that is the case. we want to continue to hear from folks if you are having difficulty getting your license in the next few weeks, for those who are getting ready to graduate, as well as if this fingerprinting issue is causing any delays or issues for you. So that's kind of the updates from LARA at this point. NASW, the ASWB, and CSWE is working on a few different collaborative projects as it relates to the COVID response. So this has anything from technology and telehealth to reducing barriers in workforce, also looking at reciprocity across state boundaries right now. NASW put out a statement about what they're kind of working on nationally, as well as there are a few good member forums on the My NASW platform, which I will show at the end of this session. One thing that I wanted to make sure that folks knew, if you have student debt, with the CARES Act passed, that does temporarily suspend student loan payments. So NASW additionally has some resources for folks as it relates to student loan debt or student loan forgiveness. We have partnered with a company called Savvy. It basically is like a TurboTax-ish like service for just compiling student loan forgiveness options for people. Members, I think it's $29 for a year to do that. It's really actually a great program. So especially if you have questions right now, they have some free stuff on their website, on the Savvy site right now, for folks who student loans are impacted by the COVID outbreak. So you can find that on the NASW national website as well. But just know, because of the CARE Act, that payments are temporarily suspended. Folks can still make payments, but if you are unable to at this point, that's a good relief. From CSWE, as it relates to field education, so for anybody who has interns or is an intern right now, this is news from either really early this week or the end of last week. So field, CSWE is allowing placements and universities to count 85% of hours to be completed in order for students to graduate. So we know that for many students, that means you're going to be done with placements possibly even this week. I know one of our interns' last day was this week. So please, if you are a student, make sure you're in contact with your university. I know the schools have done a really good job of staying in communication with their students as this transition has happened and as classes have moved virtual. But this has been a good change from CSWE. I know NASW and lots of the social work schools advocated for this and alternative options for students whose field placements had to be canceled because of the outbreak. Okay, ASWB, so the Association of Social Work Boards. This may not impact most folks on the call, but if you are taking your exam or have your exam scheduled, right now ASWB is only allowing online registration. They're waiving registration change fees, so if you need to change when your date is. And one question we've been getting from folks is, if my last year of my limited license is up April 30th, what happens if the testing centers are still closed and I can't schedule a test by that point? ASWB is working with the state boards to explore solutions to that. We have reached out to the Board of Social Work here in Michigan to see what sort of extensions that they're going to make for folks here in Michigan. We can assume that that's going to happen, and we will advocate for that to be the case. We haven't gotten a firm yes on that, but we are working on that right now. One follow-up question from last week's call, if I'm a retired social worker with an active license, are there organizations or agencies that may utilize my assistance? And last week we recommend the United Way, but we just wanted to make sure everyone knew that the state of Michigan now has a full page of volunteer opportunities for folks on their coronavirus website. So that's a really good resource for folks if they are looking for things to do and help out. I know I had a call from a member who had retired, has been out of the field for just a couple of years, but decided to reinstate their license and their liability insurance so they could help out in emergency situations right now. We know that many folks, once we get this hotline hopefully off the ground, that's going to be a good avenue for people as well. So just michigan.gov/coronavirus if you're looking for that site. A couple of upcoming trainings, not all of them are NASW related, but I want to make sure that you all have as many free or cheap opportunities to get CEs, especially as it relates to telehealth right now. U of M is hosting a webinar on Monday around teletherapy. It is full, but they're sending out recordings if you go to their continuing ed site and click on that link. The Michigan Health Endowment Fund is doing a Zoom meeting also on Monday, so you could, if you're free, have a 12 to 3 social work telehealth day. They're having a session on that. I don't believe there's CEs involved, but that is going to be a good session. We are doing a webinar on the second Tuesday, our traditional lunch and learn on macro career searching. So we know that specifically is going to be good for students. And then the other resource we wanted to make sure that people are aware of right now is PESI currently has several free programs online that relate to telehealth and the COVID pandemic. So if you go to their website, you can find all of those courses listed right now. The National NASW office has put out 6 of their webinars related to technology. They're all free for members temporarily. Well, maybe it'll be long-term, but at least right now they are free. So if you need ethics CEs, there's some specific ones as it relates to the most up-to-date technology practices and the code of ethics changes. So you can find those on the national site. And then we just wanted to give a quick update about some of the other things that we're working on, and Algeria can talk about the first couple.
Yeah, so we're working on trying to establish an emotional support crisis hotline. As you all probably saw in the news, New York recently launched their emotional support line. It was a lot of confusion around it. People thought it was more of a mental health hotline where folks could get counseling services, and that's not the case. So what we're looking to do is to establish an emotional support hotline where professionals and non-professionals can, help support individuals who are suffering from any of the ramifications right now from COVID-19. And the way we envision it to work is it will be a hotline where people can call in and then be referred out to additional services. And we're hoping that social workers will be willing to offer their clinical services if needed, whether pro bono or on a sliding scale, or whatever the need may be. So we're working with folks like the Michigan Mental Health Association and the Autism Alliance of Michigan and some others to help establish this. We've gotten support from the Michigan Department of Health and Human Services, as well as the governor's office. So it's in the works, and we're hoping that we can get that set up soon and set up the right way. Additionally, many of you, I don't know if any of you who are on the line today work in any of our jails or prisons, but we have seen, especially on the prison side, COVID-19 begin to spike up dramatically in several of the prisons. And so there are a lot of advocacy groups, such as American Friends for Services Committee, who is actually doing a Zoom call right now around this. Safe and Just Michigan, Michigan Protection and Advocacy Services, and quite a few other folks trying to create some changes to let individuals out of prisons who are older and vulnerable and frail and things of that sort. So we feel pretty confident that the governor's office will soon release some type of executive order around that. But that's something that we're working on supporting as well. Communication with the schools of social work. We have been in communication with the schools of social work also around how to help out with this statewide crisis hotline. I know, as you all are aware, Detroit is experiencing the grunt of all of this COVID-19 crisis, and I know they're getting ready to establish their own hotline down there soon. And so hopefully that will be launching, and we're hoping that the schools of social work will also assist in this hotline, and students can join in to complete their continuing education hours as well. So those are some of the updates that I have. Dwayne, did you want to talk about continued clarification from LARA and Michigan Board of Social Work?
Yeah, I mentioned most of that already, getting clarification about the fingerprinting, around continuing education, about extensions being made. We know that they are all scrambling for answers too right now. So we have put calls out to the chair of the Board of Social Work, as well as had some communication with LARA. So there's nothing more to say, I guess, besides that right now. I did want to let members know that National still has their ethics hotlines 4 days a week. So if you have specific ethical dilemmas as it relates to things going on right now, or just general in practice, they have Monday through Thursday. They have some specific times that you can have call in specifically related to ethics. You can also call us at the state, and we have an ethics committee, or Max is really great at answering ethics questions. And then the national office has also put out 8 ethical considerations for social workers as it relates to the coronavirus. So that's a really good article to check out if you haven't seen that. I know it's probably things that many of you have already been thinking about already. Okay, so before we kind of transition into any other questions that folks have, and I see that the chat box has been really active and that Algeria has been answering and that you all have been answering each other's questions, so really thank you for that. We'll make sure that the transcript from the chat box is also put up on the website so folks have all of those questions. Someone said, with LARA being closed, does anyone know if more malpractice insurance is needed for telehealth sessions? So NASW Assurance Services does also allow a cyber therapy rider that you can add to your current practice. It's not required, but it's highly recommended, especially right now as folks are moving to completely online services. The more protection you can have, the better. I did see there was a question. Let me see. I'm still trying to understand the language of my professional liability. I do have the added liability insurance for cyber liability, but I'm now reading that if a breach of security happens on the technology, that we may still be liable for it. That's something that I can reach out to Assurance Services and see if there's some clarification on that piece, Liz. And I don't know if that's who you have for your liability, but I will reach out to my contact and see if they can give some clarification on that. Okay, so just really quickly, a couple of these resources that I wanted to share with folks. So on the NASW Michigan site, which hopefully most of you are familiar with, we have added a new COVID-19 resource tab at the top. So if you go there, there's several really good links from that drop down, anything from what we're working on to legislatively things, to webinars and trainings that are related to what's happening, to other training opportunities, so the ones that I mentioned like U of M or PESI, and then updates to telehealth. So feel free and to continue to check back. We're going to try to update that at least several times a week as we get new information. Please feel free to share stuff with us if you're finding really good resources or a training in your community that's being offered, or I know a lot of the schools of social work are putting out programming. U of M put out a really good guide to services around COVID response. Wayne has put out some really good stuff around telehealth. And so we're trying to share as many of those resources as possible with you all. So please feel free to check back on this part of the website. Nationally, if you go to the national site, which is just socialworkers.org, then on the main page, there is their responses to COVID. And if you just click on that link, that'll bring up all of their different options, including ethics, webinars, stuff around self-care, preparing your practice. So lots of good stuff on the national site, pretty easy to navigate there. So then the last one that I wanted to show folks, because I'm guessing most folks on the line probably haven't used the My NASW platform before. So this was created about 2 years ago, and it's NASW's online member community. So if you are a member, this is a really good way to share resources, to ask questions to other practitioners if you need something that's more maybe immediate. If you just go right here at the top, if you're logged in, you'll click on My NASW, and then you'll visit My NASW community right here. And so once you're in that platform, it'll bring you to all of the different community options. So you can see there's the most latest discussions, upcoming events. Most of these are probably going to be postponed, I'm guessing, announcements. But where I wanted to show you is under this community tab. If you click on My Communities or All Communities, it'll bring up the different options and the different forums that exist. So the all-member forum is probably going to be your best bet for stuff right now. And so you can see there are 22.5 thousand discussions in there. So if you click in the all-member forum, it's going to bring you to all of those discussions. Or if you click on discussions. So then you can kind of see lower reimbursement rates, hospital social workers, Zoom security, and it's a really good way that you can share files, you can share links, you can ask questions to other social workers in there, and then they're usually based by thread. So there may be a thread based off of just telehealth resources, or maybe one based off of students. That's another really good option for folks if you're looking for another opportunity to talk to people, to share resources, to share ideas. If you're finding something or having an ethical question, this is also a good place. But I just wanted to physically show folks because I know most people probably haven't navigated to that before. It is still a fairly new member benefit. The library tab here kind of in the middle, that's going to be where files that have been shared are attached. So you can see just recently handling workforce death and grief, online resources for kids, Blue Cross Blue Shield Pennsylvania, updated telehealth Indiana. Some of these are state specific, but those may be some good places to go through and navigate on if you have some downtime and see if there's anything that's going to help you with your practice. And you can always just search too if you're looking for something specific and find it that way. So I just wanted to make sure people knew about that.
I have one little update that I wanted to just mention that just came to my inbox, and it's around small businesses. So there was just an executive or just a press release sent out by Lieutenant Governor Gilchrist, and they're creating a small business Michigan protection task force. And so they created the Michigan Paycheck Protection Program. And so what it does is it provides small businesses Michigan COVID-19 relief, and it gives them funds to pay up to 8 weeks of payroll costs, including benefits. The funds can be used to pay interest on mortgages, rent, and utilities as well. And funds are provided in the form of loans that will be fully forgiven when used for payroll costs, including in payroll costs, interest on mortgages, rents, and utilities, etc. So individuals who are eligible for this program also include nonprofits. So I'm not sure if you all have agencies or things of that sort, small businesses, but I would definitely see, if look into this program to see if you're eligible. It says nonprofits, veteran organizations, tribal concerns, self-employed individuals, sole proprietorships, and independent contractors, all affected by COVID-19, are eligible. So I'll add this link in the chat box, and we'll make sure that we get this information and this website up on our website. But I know many of you and your organizations are affected by COVID-19, and that might be a good resource for you all. So just thought I wanted to add that in briefly.
Great, thank you. All right, I know there are a couple of questions that have come in. They look specifically related to private practice, so I wanted to see if any folks on the line had any other general questions before we kind of move into that segment of today's call. And if folks need to log off or get off today, they're more than welcome to. But I think we're done with kind of our formal business for today. There's not CEUs for our calls. For these sort of calls, we will offer a couple more CE opportunities in the next couple of weeks. But yeah, we can't do it for this call, unfortunately. Any updates relative to cross-state line services permission? So we are still working on that here in Michigan. Algeria, I don't know if you have any updates on that in terms of your communication, but this still is a state-by-state thing happening right now. Unfortunately, since licensure is regulated differently in every state, there's no way to nationally do this right now. We know that several states have opened up their therapy to allow folks from who are licensed in other places, other jurisdictions, to be able to provide services to their residents. Michigan has not done that yet. We are working with the governor to try to make that happen. So there may be some opportunities for folks to advocate on that. Algeria, do you have any update at this point?
No, I think you provided the best update. I don't have an update as of that yet. We're just still working to make it happen. I mean, it'll definitely be a combination of our Board of Social Work as well as the governor's office to make it happen.
And then kind of a follow-up from that from Ashley was, for states that have opened up services, how do we connect with those people who need support or get on a listing for available therapists? Many states have done what we are, well, not many, several states have done what we are trying to do by creating hotlines, mental health hotlines, and they have provider signups. I know New York has done that. So if you have a particular state in mind that you know has opened up, New Jersey, New York, you can check those sites and get your name signed up there. That's my only suggestion at this point. It really, since everything is so state by state, it can be pretty tricky. If you have an idea, or if you've heard of a state that you think you may want to provide your services to, I would recommend reaching out to the NASW chapter in that state, and they can let you know how to best get connected. All right, so we're going to go ahead then and move kind of more into our private practice part of today's call. I'm going to go ahead and I'm going to open up Julie's line. So give me just a second, Julie. Let me find her. All right, Julie, I've unmuted your line. Julie is our chair of our private practice and aging groups. And I want to thank her for allowing us to infiltrate her meeting today with today's call. So if folks do need to get off, I know that folks have busy schedules right now, but please feel free to stick on if you have questions or want to hear kind of these updates. There were 3 questions that came through for folks that I'm hoping that maybe we can at least start the meeting off and address. Julie, I don't know if you had anything else that you wanted to kind of give us as an outline for this part of the discussion.
Dwayne, actually, I just kind of, because this is the first time we've had an ability to meet as a private practice group since the whole COVID process has started. So I really just wanted to kind of keep it open. There have been questions, like you said. So I've also been tracking those, and we can have a greater discussion, I think, specifically about these modifiers and place of service. We'll definitely touch on that, as well as a few other questions that came up.
Great, and I know that those were a couple of the questions that came through were specifically around those modifiers, so I think that'd be great. We can discuss that one.
Okay, so
and if folks would like their lines opened, please just type that into the chat box, and I'll make sure to unmute you.
Okay, so, and I think that's good too. If anybody has other questions related to private practice, we also invited the aging group to stay on, so I don't want to forget about those folks. Our afternoon meeting generally meets 1 to 3, but for purposes during this COVID process, we invited the aging group to join us through this meeting. So if any questions come up specific to that group, please also add them or speak up. Okay, so let's touch base really quick. I don't know, really quick on the modifier code as far as telehealth. And I think what we're seeing through the questions is there's a lot of confusion for this. And I'm not saying that I have the exact answer. So I'm looking at a couple resources. And as Max had said earlier, when she said that a biller had told her things are changing on a regular basis, I think we're seeing that with a modifier. So I've got a couple sources that I want to touch base on. The confusion between using a modifier 95 or GT. This, as I understand it, goes back to commercial insurance versus Medicare. And initially, as I understand, commercial insurance were asking for modifier 95. Medicare was asking for modifier GT. With place of service being code 02. Now, just to throw a wrench into everything, I'm looking at a website. It's called Coding Intel, and they're posting. And this is a website that is specific to coding questions, and it's for coders. But they have a lot of really good information. Are they correct? You know, they're purporting themselves as being, you know, knowledgeable in the coding field, which is more than I have. So I'm kind of looking at that as perhaps they've got some correct answers. So what they did was yesterday, what's today? Yes, yesterday, 4/2, they posted a question and answer to frequently asked questions document. And I don't know, Dwayne, if I can send this to you or not to post, or if that would be going down a rabbit hole. But what I pulled out of it is that as of yesterday, get my multiple things here. As of yesterday, they're stating that Medicare gave an update, and that Medicare is saying use the place for place of service, use the place that you would have used if you'd seen the patient in person, and add modifier 95. So again, this is according to Coding Intel, their Q&A for frequently asked telehealth questions. And they're saying that this is a brand new update from Medicare. That doing this will allow you to get paid the non-facility rate for office visits. According to their information, Medicare had been changing and trying to apply our coding to the facility rate, which is about $20 cheaper or less for reimbursement. So using the modifier 95 and using the same place of service of where you would have seen your client. So if it was an office visit, they're saying use POS 11. And that commercial payers will most likely continue to use place of service 02. So that is something that I'm just looking at pretty much hot off the press. So is this confirmed? Nope. I think we're just in a scary time, and we have to try things, and we're going to get denials, and it's up to all of us to pay particular attention to the reasons that we're getting denials, and just kind of have maybe a note close by telling you what else you could try. I would also track your dates. So this is dated 4/2. So I don't know if that's going to apply for any kind of services that you billed in March, but right now this is what I'm hearing. Anybody have any questions about that?
Ashley was going to play devil's advocate. If we get reimbursed, does it really matter what modifier we use?
Okay, so one of the things I heard early on from Medicare is that they're making changes to the rules during this national emergency. And if we get audited, they're not going to look for certain things. So they're not going to look to see if our platform is HIPAA compliant, because they've waived that. And we have our own code of ethics, but according to CMS, they were saying they're not going to look for certain things if we get audited. But that's what they're saying now. So I hear what you're saying, Ashley, and I appreciate you know, doing the devil's advocate. I think we just have to continue to keep in mind that what we're promised right now in a time of national emergency, how much faith do you have that our government and Medicare or other insurance companies are going to respect those promises now if we get audited later? So to answer your question, yeah, if you're getting paid, that's cool. But I don't know, how much faith do you have that promises will be kept? That's a personal choice.
Julie, a couple other questions as it relates to that have come through. First one from Deborah, what about modifier AJ?
I have not heard about AJ. I saw something in the NASW community early on, so several weeks ago, and that modifier came up, but nobody really seemed to identify with it. So I'm not sure what it's in relation to. And I have not seen anything on the community posting. And anybody who followed that NASW community, there's been quite a lot of communication and information shared there. I pulled out everything that I saw. GT 95, those were the two that really seemed to resonate with people, and they were encouraging people to use them early on. The AJ, I saw that once, like I said. GQ, I can't remember that one.
And it looks like there was a couple comments on that from folks. From Liz, I believe AJ is about billing under supervision. And then from Jenny, Blue Care Network plans require the AJ modifier. Would either Liz or Jenny want to talk about what you know about that?
Hey, this is Liz. I have a billing company, thank God, because this stuff is all the way confusing. And so in my practice, I do hire limited licensed social workers that I provide the clinical supervision for. So my understanding is that Blue Cross Blue Shields and some CHAMPS Medicaid will allow LLMSWs to provide therapy services under the supervision of a fully licensed person, which is why they use the AJ modifier. But that's not Blue Care Network, only Blue Cross Blue Shields and Medicaid, Blue Cross Complete, Meridian, and straight Medicaid.
So do you know, Liz, if that is for video conferencing or in general supervision?
Say that first part. I missed that first part, Julie.
Do you know if the AJ modifier is specific to video conferencing, or is that specific to the supervision of an LLMSW?
Specific to the supervision of an LLMSW. So this goes back to the question that was asked earlier on one of the slides is, I have no idea if my clinical supervision of the LLMSW is providing teletherapy right now. I don't know if that's going to get paid. I hope. We'll see.
Okay. So there, you know, modifiers, as I think most people know, we have the ability to add more than one. So possibly putting down AJ for the supervision and then 95 or GT or whatever other video modifier perhaps is a way to go.
Thank you for sharing, Liz. All right. Are there other questions as it relates to modifiers or codes?
I did see something in the questions. I don't use Medicare. Something about I don't need bill Medicare. Do I still need to use a modifier? Just for clarification, remember modifiers are specific to certain situations. So Medicare sometimes has different modifiers, either numbers or letters that they use for specific differences, like using video or telehealth. Commercial insurances may have the same modifier, or they may use a different modifier for specific special situations. So if you're not seeing a Medicare client, obviously you would not use the Medicare modifier, but that does not mean you don't use the video telehealth modifier specific to your commercial insurance. Now, if you're billing privately, then you know you're in a whole nother world because these codes are for insurance purposes, right? So hopefully that helped.
I saw that Liz just commented on your teletherapy consent form. You should ask for emergency contact and the numbers to the nearest hospital/police station. And I do know that on the My NASW community, folks have been sharing examples of consent forms. So that's a good place for folks to check if they are looking for some examples for that.
I appreciate you bringing that up, Liz. That's a really important part. We do need to have a consent for telehealth and video conferencing. So if you're using that service with your clients, you do need to create a consent form. You can mail it out to them. What I'm reading through CMS, you can meet with your person, video conference, and then send the form out, but you do want to show maybe in your records or in the note that you've received verbal permission to meet by video conference, but then best practice is get something written out to them. You can mail it out to them, have them sign it and return it, and keep it in your records. And another piece of advice that came from personcenteredtech.com, they have a free video that you can watch for telehealth information, as well as iPlum, which is an app, and VC. They also have some free instructions on telehealth. But what they identified is, to tack on to what Liz says, make sure you know where your client is. If they're in their home, just kind of go through some questions. Are you in your home? Are you able to speak confidentially? One of the suggestions is, can you ask them to pan their area to make sure that they're in a safe space, or that what they're telling you is accurate to what you're seeing. And then make sure you do have, if they're in their home, have their address present. If they're not in the home, find out what that address is, so if there is an emergency, you can get help out to them. So those were some of the suggestions that came from Person-Centered Tech. I'm trying to read. I've got two screens. I got the little screen that my camera's on, and then I got the big screen I can actually read without glasses.
Julie, one of the questions that came through, and I can help facilitate some of these, is can anyone elaborate in regards to the telehealth policy to have the client call the clinician versus the clinician calling the client for phone sessions? In video, the clinician typically initiates the invitation through an email. Thoughts on the other way around with telephone?
I'm not sure.
Anybody have any thoughts on that one? Deborah, I see you're trying to talk. Let me unmute you real quick. All right, you are live. Deborah, were you trying to talk?
Can you hear me?
I can hear you.
Oh, I'm so confused about this stuff. I bill my own Blue Cross Blue Care Network, and they have not been helpful as I've reached out to both of the, and maybe this is taking around the block, but I lost my train of thought. I apologize. As far as the initiating, if I'm running late, you know how you run a few minutes late? I think it's best that we contact them. Does it really matter? I'm not sure. If they call in while I'm on another call, they get a busy signal, or the connection would fail. I would like the opportunity to initiate.
Yeah, Margot also commented, I would have the therapist initiate all contact, because if we're back in our office, in our work offices, we would be greeting the client first.
Correct.
Yeah, I think folks should try to be having that initial contact. Obviously, it's a little bit of a tricky situation. And even just like your phone record, I mean, you would be able to see who initiated that call. Yeah. Maria said, I would think that we could initiate due to the platforms being used. Example, on Doxy, clients cannot start the call. So depending on what platform you're using, that may actually dictate how that goes. And actually, that was one question that I was curious to ask the group in terms of what are the platforms that you all are using for telehealth? I know NASW as an organization doesn't like recommend one, but are there common platforms that you all are finding that are good or bad, depending on what you've used?
Wayne, this is Max. Am I muted or not muted?
Nope, we can hear you.
Okay. You know, I'm not particularly high tech, so I'm dealing with my own trauma about this, but I'm using Spruce Health, and it seems to be fairly simple because I'm using it, which is a good test. And with that, I have another question. Many of these virtual systems, you have to send an invite to your client. The client fills it out, and then you're set up to do your virtual session. Really, can that, the fact that the client fills out that form, can that serve as a consent?
When you say filling out the form, you mean when they register with the
Yeah.
app?
Because they fill in their name, their phone number, they get the invite.
Yeah. You know
So
what? I go back to when we start services with someone, we have a consent and authorization that we have them sign, but we also have to have a, you know, recognition of HIPAA, electronic HIPAA,
mhm.
any release of information to talk with anybody else. So I hear what you're saying, but I wonder if maybe when they fill out and they sign up for the platform, if that isn't more like the consent or the authorization to start, but we need something maybe a little bit more specific that kind of identifies how we're going to work with them via video. So again,
Right.
you put in that consent that they sign that this is still confidential, that they should be in a place where they're not going to be interrupted, you know, like with children running into the room, or if you're doing child therapy, if, you know, can the child be in a room by themselves and make sure mom or dad or someone isn't hiding in the corner, you know, saying, don't tell your therapist I'm here, you know, so we can set guidelines of what we expect in that video relationship. And then that I think is what you would have them sign in return.
Okay, so you're using something, right?
I'm using the same thing. I'm using Spruce Health.
Okay, but you're also using a form that you've developed?
Yes, and that was based on, I took the sample from Person Centered Tech that they offered, and then I modified it a bit to be more specific to my
Okay.
practice.
Are you willing to send that out to those of us on the call?
Yeah.
Okay, great idea, Julie. I'm glad you thought of that.
Oh, Max. Okay, I'm making a note.
Okay.
And it looks like from the comments, Doxy seems to be the most popular, at least from folks who chatted in. Simple Practice and Spruce Health was also mentioned. So I'm just going to create a little list of platforms that I hear about, just so we can give folks some guidance if we get questions.
Hey,
Thank you.
Dwayne, I have about a dozen identified. I'll send that to you.
Oh, perfect. Great.
Yeah, and some of them, you know, the other thing to keep in mind is And again, from the NASW community conversations that I've been reading for the last few weeks, like DoxyMe, and that's a real popular one, like you said. Simple Practice, and some people, they have EMRs and they have the ability to telehealth through their EMR. VC is another one. Keep in mind that you want to have a business associate agreement, and not all of these do offer that, or they offer it if you have a higher platform. So some of them offer like a free platform, and then some of them say, well, there's going to be a monthly cost, and if you do the monthly cost, then you get a business associate agreement. But for best practices, we need to have that. You also want to make sure that it's HIPAA compliant, and I know Medicare has said you don't have to have HIPAA compliant
We need it anyway.
platforms, but again, yeah, we're social workers, right? And
Right.
we have our own code of ethics. So let's really make sure we can, in every possible way, uphold ourselves to those standards. Some of these platforms also have additional services. Some are only video conference. So you really want to understand what it is you're getting into.
Okay.
And like I said, I will send out what I have to Dwayne. It'll probably be later because I do have some afternoon appointments, but I'll get it to Dwayne over the weekend, and maybe Dwayne, you can send it out early next week or post it. Cool. Okay. What else we got?
I have a question.
Yes.
So the private practice group, I mean, I'm getting so much out of this. Thank you so much, Julie. How do I join on a regular basis, or do you guys meet at a certain time?
Okay, I appreciate that question. Yeah, so the private practice and the aging group, because we've opened that up to them also.
Okay.
These are two of the specialty groups that NASW Michigan holds.
Okay.
I facilitate both of these, so I can speak for both of these groups. There are other groups, and it's on the website for NASW Michigan. But as far as joining, usually what we do is we have a very open format.
Okay.
You can come into the office. I mean, obviously not now, but most of the time you can come into the office if you want to meet people or be face-to-face. Most people call in just because getting to the office in Lansing is not possible. And so what will happen is if you call the office, and you can either give, Dwayne, correct me if I'm wrong here, give you or Sam, who's a receptionist, your name and your email address, and then Dwayne can put you on the list so that when we're having a meeting, you'll get the agenda, which I have to admit I don't always get out on time, but I try. Reminders and announcements for the group, you would get those for either the private or aging. And then what will happen is, and when Dwayne sends out the reminder, it'll have the call-in number.
Okay.
And at 10 o'clock for the private practice on the first Friday of the most months, we don't do all months, but most months, it's the first Friday, and it's 10 to 11:30. And you would just call in. The
Okay.
meetings are recorded. So, and then they're posted on the site if you want to go back and listen to previous. Is it listening, Dwayne, or is it reading? Because the meetings get.
It's the audio of the meeting.
Okay. So yeah. So
The other option is if you want to add yourself to the group roster, if you go to the Get Involved tab on the NASW, and anybody on the line, if they want to get added to any of the groups that we offer, if you go to the Get Involved tab, and actually I can just show you on my screen how to do that.
Thank you.
Just Get Involved tab, and if you go to the work groups, you can just find the one that you're interested in. So if you go to private practice, you do have to be logged on, but what you'll see here at the top, you'll see the roster, the meeting minutes, and the resource list. If you click on the roster, you can actually just go to the bottom and add your name and email address. And then that's the list we use to send out updates. So you could just go ahead and add yourself, and then you'd be on there. You could also either call or email us at the office, but if you want to just do it yourself, that's the easiest way.
Okay. Thank you.
And then for the aging group, we meet again the first Friday of most months, and that meeting time is 1 to 3.
Okay, thank you.
What we really want, I mean, sometimes it ends up where I do a lot of talking, but I really want to encourage people to join and to be active, because it's not about, just yammering on. It's about the collective knowledge that we all bring to the table, because we're the ones out there, working with our client group, working into our specialty areas, and we know more collectively than we do individually. So really encourage people to submit questions or bring up information that they want to share with the group, and then we put it on the agenda and make sure people have time to speak on those things or resources and stuff.
And I continue to advocate for a time for people to bring up, you're laughing, to bring up challenging cases or clients, especially now that we're doing this virtual stuff. It sometimes creates a different dynamic between therapist and client that clients struggle with and therapists struggle with.
Right.
It's challenging. Maybe struggle is too intense of a word, but I think this provides a time to talk about those concerns that we have regarding specific cases, regarding our own issues and working in this new format. So I keep, when Julie and I are physically present, we tend to challenge each other back and forth, but I continue to advocate for that as an ongoing part of the agenda, Julie.
Agenda. It does get put on the agenda. Just again, I encourage people to bring cases up to discussion.
Yeah.
Because it's a wonderful platform for all of us to learn more and to support each other. And we also find issues come up that we take to NASW and we say, hey, this is a problem. And can you help us work with it? And I remember one of the first issues that came up when this group started, and I don't remember how many years ago it was now, but it was the point that Blue Cross Blue Shield was not reimbursing social workers. And Max and NASW Michigan spent a lot of time advocating, and now we are. And so, that's something that came about through this group, just one of the So it can be a very powerful platform for all of us.
Julie, there was a question that came through that maybe isn't case specific, but is somewhat client specific that I'm wondering if the group might have an answer to. So the question was, my peer had a question about the typical billing of a 15-minute minimum for contact with a client, and wondering if that is still a requirement for teleservices. Their caseload includes individuals who are less verbal or that is not their primary mode of communication, and it has been challenging to keep them engaged on the phone for that amount of time. They are contacting these individuals by phone 2 to 3 times per week for about 5 to 10 minutes at a time in an effort to total about 60 minutes per month. My peer has been instructed to document and bill these contacts with a specific COVID telecommunication code for the CMH, which they work, but is questioning if a 15-minute minimum is still standard. Wonder if anybody has any thoughts on that.
I have not heard differently. Actually, my understanding is that and I could be wrong, my understanding is that the minimum is 30 minutes, but you must see them for at least 15.
Are you saying 15 or 50?
1-5,
15.
right?
Thank you.
Yeah.
So did you say CMS, so this is going through Medicare?
Well, it looks like this is CMH that this is happening at.
Oh, okay.
It doesn't say how they're billing.
I I think my recommendation would be, unless someone else has heard specifically already, my recommendation is to call the billing source. So if it's Medicaid, if it's straight Medicaid, it's HMO Medicaid, if it's Medicare, or if it's commercial, and going to have to ask them specifically for that one.
I get a little confused. It's a CMH client and a CMH therapist.
Yeah.
And if that's the case, then I would just go back to the CMH system and let them answer that question, because I know CMHs are in the process right now of figuring out this whole mess with respect to their clients. So I would feel a little uncomfortable with NASW providing advice over the CMH.
Liz just shared a resource. It was actually an NASW practice perspective from winter of 2017, most frequently used CPT codes. And with 90832, it does have a minimum of 16 minutes listed for that code.
And that's that 90832, that is the 30-minute, and you have to be there 30 minutes or half of it. So, but it's saying 16, so a little bit more than half. Thank you, Liz. Do we have more questions?
Seems like
The other
someone
one-
asked for Dwayne's hogwart. Are you going to respond to that, Dwayne?
What?
Someone just asked about your hogwarts.
Oh, you must have been listening out at the beginning. I was trying to get a fun background for behind me for this call. So
Yeah.
we can change it, but I couldn't figure it out right before. So next week you'll see some fun background. I'm not sure what it's going to be. Could be Hogwarts, could just be a cat collage. Wait to see.
I just saw that
Some
question.
really interesting things that have been happening with technology. I saw platforms where you can turn yourself into a potato and talk like that. Like, people are getting real creative.
You know, and I think there's a need for humor in these groups.
Yeah, 100%. On a non-humorous note, the other question that came through, and I thought that there was some dialogue in there, but maybe just to bring it up, prior to COVID, I would assess if telehealth would be appropriate for a client, safety, suicidality. In the past, if a client expressed suicidality, I would move them to face-to-face sessions. I'm now doing 100% telehealth with clients. What if I have a suicidal client? I cannot see them in person for assessment. With hospitals overloaded, should I ask them to still seek psychiatric help or call 911 and or their emergency contact? Thoughts?
So again, I think if we revisit our code of ethics and what our responsibilities are to our clients with safety in mind, and then recognizing that we are essential professionals. So we do have the ability to see people in person if that is something that you feel you're able to do. That is still available to us. I have a home-based counseling practice, and right now about a third of my clients I'm still seeing face-to-face. And there's personal ethical challenges that I have with that, but for various reasons specific to the vulnerability of some of my clients with severe mental health issues, schizophrenia, suicidal ideations, fragility, you know, emotionally, or they lack technology. They just don't have it.
Right on. Mm-hmm.
So that being said, I recognize not everybody is comfortable going out and exposing themselves. So this is not a judgment, it's a recognition. But let's go back to safety. If you're seeing them by video conference, again, making sure you know where they're at. having them pan, you know, their camera so you can see their environment. 911 is still available if they become actively suicidal. That is something that is still available out there. Although Detroit sounds like, you know, they've been hit pretty hard. A lot of their police officers are out, and across the state, I would imagine. But that's still the resource that we have. The other areas that I would say is, you know, use what we always have. Use your contracts, verbal contracts, send them a written contract, use the mail, use email, especially if you can sign up for a HIPAA compliant platform. The idea here is we want to make sure that our clients are supported, that they're getting the services that they need. And that's not just something that social workers do, but we know the medical field does it also. So I would believe that your hospital systems, your mental health systems, wherever you're at in the state, have something set up for this. Perhaps reach out to your CMH, reach out to your hospitals where the behavioral health ward is, and ask them what, if you're concerned about this, ask them what their protocol is if someone is suicidal, and kind of go from there. Those are my thoughts.
Thank you. That's helpful.
And as we're living in minute-by-minute news updates, I just did get an update from LARA around the continuing ed piece. So LARA just sent out an email saying that social workers with licenses expiring April 30th, if anybody's in that boat this year, who have not met continuing education requirements due to COVID, can still renew, and they do not have to submit any additional documentation at this time. So they can still just renew online as long as this executive action is in place. So just wanted to give that update while we're all still on the line. News is changing so fast these days.
Is 96127 a telehealth for 90871? Or I'm sorry, I gotta write it down. Yeah, 90871.
I'm not familiar with 96127. Is that someone else able to speak to this?
I'm not familiar with it either. It was from Sunshine Adkins. I don't know what that is.
Dwayne, do you see that? Request is.
Sorry, can you repeat that?
Can you unmute Sunshine Atkins?
Oh, let me see if Sunshine is still on. All right, Sunshine, you are unmuted.
All right, perfect. Thank you. So like when I am doing the SAQ or something similar to that, the metric, oops, hold on, sorry. I thought I had, anyways, oh, now you can see me. I had my, so before I would have the actual metric. I work with high functioning individuals with ASD primarily. So the focus on the depression, anxiety. I work through them with the metrics themselves, like the GAD, the generalized anxiety assessments, things like that. So, and I talk them through it, make sure they don't have any questions, and then use that metric every couple of sessions to assess where they're at, depression, anxiety, etc. And 96127 is an assessment, a code that I use for billing that. in the sessions. So my question is have you guys heard of anything as far as insurance is covering the 96127 via telehealth versus in person? Or are they not? I know I just know of some clinics that use different metric platforms where the client actually goes in and fills the metric out before the session, and that's billable. But I don't have a platform. I physically do that, with the client. So I just wanted to get other people's ideas or thoughts about that and how I can continue to do the assessments.
I'm not familiar. Is there anyone else on the line who could maybe speak to that?
I'm not familiar with that.
Okay. Well, thank you and maybe I'll just keep looking into it.
Yeah, and I wrote it down. I do have a biller, so I can send that out to her and see what her comment is on it.
Okay.
Who is this to commercial insurance or to Medicare, Medicaid?
So I do, I bill for Blue Cross Blue Shield of Michigan and Blue Care Network, and then private pay, of course, and have a fee for, all of those.
And you use that code, that CPT code, in lieu of like a 90837, or is that an add-on code?
It's an add-on code well, it's not necessarily add-on code, but because you can bill it separately for a client, but I use it in conjunction with the assessment with the sessions, to check in and see where's their anxiety, where's their depression. And a lot of insurance, especially Blue Cross, wants to see now the progression of the sessions and to see if, is it working, is it not working. Prior to when we had to do the treatment review forms, we had to use a lot of those. And now Blue Care Network doesn't require the treatment review forms. However, still, it's just a good assessment tool to use with clients too, especially my clients who they like to see visual aids and how things are working. How is the therapy working or not working, or where are we getting stuck? So I use that in a lot of different ways, but the insurance, really, not many insurances like us to use that, use metrics. So that's just the way in which I've been using it for the clients I work with.
That's real interesting.
Right.
I think a lot of us are using, different assessment tools, but I had not been aware that people were able to get reimbursed specific to that.
Yeah.
So it's good to know. So yeah, I'll follow up on that and find out some information.
Okay, perfect. Thank you. And I'll add my name to the list because I really appreciate this format. I've been really missing something to stay connected, especially now on the telehealth stuff. I'm just feeling so lost. So I appreciate you guys being here.
Before you hang up, I do have one thing I'd like to add. Are you about to hang up?
Let's go for it, Max.
Pardon?
Go for it.
Okay, so talk about humor and creativity, right? So I have this dog that whines and barks during meetings. So during the course of this meeting, I've discovered a brilliant way to keep him occupied for quite some time. And I thought I'd share that with those of you who just might have an interest. So two things. If you have a plastic peanut butter deep container that's almost empty, you can give that to them and it'll occupy him for about 10 minutes. When that fails, you can go through your trash and find an empty plastic egg carton. Open it up and put peanut butter in each of it would be 24 because it has a plastic cap that folds over. And then fold that over and wrap, this is, the special healthy eggs. Then fold over the top and put a little bit of peanut butter on the top to get their interest. And I've found so far it's taking him about 25 minutes to discover ways to open it up and get the peanut butter out. So if any of you have problems with dogs barking or whining during your sessions, that's my advice for a creative solution. So I just wanted to share that since somebody said creativity would be appreciated during these sessions.
Thank you.
He's still going at the egg carton. The other dog took the peanut butter container.
Hey, Max,
Yes.
I'll send you a picture, but we have 2 new puppies.
Do
Oh.
you? Oops, there's a dog fight. So much for that solution.
Oh, no.
Oh, well, back to the drawing board. Send me those pictures.
I'll send you pictures.
All right, bye.
Okay. Hey, I just want to kind of give an update. I did get a response back from my biller in regard.
Oh, Julie, you got muted, or you are muted somehow. You can see your hands waving, but I can't hear you. I don't know if other folks can.
I can't hear her.
Don't know sign language.
Oh, you're back.
Oh, okay, good. Okay. So I just got an update from my biller in relation to the modifiers, and she is confirming that as of yesterday, Medicare and Medicaid modifier for telehealth is now 95. So it was GT.
Oh, wow.
So that is accurate. Yep.
Wow, changing every second.
Every second, yeah.
Yeah.
I'm wondering if there's anybody on from the aging group who has anything they want to bring up. I don't want to forget them.
Hi, it's Ken Sherman.
Hey, Ken.
Hi. Just to let you know, obviously, that the Elder Abuse Task Force meetings with the state are on hold indefinitely.
What?
The Elder Abuse Task Force is on hold, it sounds like, indefinitely.
Right.
Yeah, it's a bummer.
That is a drag.
I've seen a couple things come through with Michigan United but with the task force. Do you know if anything is being worked on separately and we're going to get any updates, or are they literally on hold?
Are you asking me?
Yeah.
Oh, okay. I didn't know who you were. I haven't heard anything.
Okay.
And just one last quick update. I got another email that just came through. Wayne State School of Social Work is currently, they've developed a telehealth provider support hotline specifically for folks in Metro Detroit. So they're wanting to support and debrief with frontline healthcare providers and first responders to help them through this demanding time, and they're calling for licensed social workers to serve as volunteers for that. I'm about to post that. It'll be on our Facebook page, but I'll also make sure that that gets up on our website. So if any folks have some time and would be interested in volunteering, that's another opportunity that's just come through.
Thank you.
All right, I don't see any other questions right now, Julie. Does anybody else have any other business that they'd like to bring up today? All right, well, thank you all for testing this technology with us. It actually worked pretty good. I'm happy with how we were able to have this. So we'll have our next call next Friday as our regular checkup. The private practice group will meet in May. We'll see where we're at in May. Could be another one of these. Might have some other options, but stay tuned. And if you want to get added to the list, either just email myself or call the office, or you can go right to on the webpage. And I did put that link in the group chat. And we'll make sure that this video will be put up on the NASW website as well as the group chat log. So thank you, everyone. I hope you all have a good weekend.
Will you please mention this to your colleagues and to people that you know who aren't members who might find this a reason to join? Thank you.
Thanks, Max.
Sure.
Thanks, everyone.
Thank you all. This
Bye-bye.
is great.